When times are tough, places like the Saban Free Clinic in Los Angeles get busier. Chief Medical Officer Janai Robinson says the state is slashing the Medi-Cal reimbursement rate at a time when the clinic needs the money most.
We have more and more patients at our door who are in need of services, and the cuts to the Medi-Cal, which is one of the few programs that pays us to see patients, further impacts our ability to take care of all the patients that come to us.
The California Department of Health Care Services knows the cuts are painful, but says they're necessary to save the state more than $600 million during these tough budgetary times.
To me, that seems inhumane.
Janai Robinson says the state needs to rethink its priorities.
We won't even consider raising taxes on the very wealthy, and instead we want to cut the services to those who are most in need.
The Community Clinic Association of Los Angeles County represents 57 nonprofit health clinics that serve 1 million patients per year. President Louise McCarthy says clinics will lose some money. She says there'll be a bigger problem when independent providers and specialists who've long struggled with Medi-Cal's bureaucracy and low reimbursements decide to pull out of the system.
And so patients will not get access to the providers that have previously seen them. And whether that's their primary care provider or whether they're sitting at a clinic trying to get access to a specialist, there might not be as many specialists available to refer to.
McCarthy says those doctors might decide it's just easier to volunteer at occasional free health care events like the one last week in South L.A., but they'll opt out of programs like Medi-Cal. Brian Watt, 89.3 KPCC.